In the fall of 1995, a new era dawned in the Carolinas.
For some, the Carolina Panthers' inaugural season of 1995 seems like forever ago, while for others, it feels like only yesterday.
All right, let's make a play here. Let's keep him out.
One of the Panthers' first draft choices that inaugural season was Frank GARCIA.
I was 6 years here with the Panthers, 2 with the Greatest Show on Turf, and then 2 years with the Arizona Cardinals.
Playing center, Frank made his living blocking, but earning a living in the trenches of the NFL was no Sunday picnic.
Every week was a different injury, playing in the NFL. I had a broken foot, I had dislocated fingers. I had a stinger on my neck one time so bad that I couldn't lift my arm. Multiple concussions. Probably the most significant injury was an MCL. I missed 4 weeks.
As is the case with many former players, the rigors of playing 125 NFL games over the course of a decade took their toll.
Father Time is undefeated, and as we get older, we start breaking down. You start feeling that wear and tear you put your body through, and like a tire, you only have so many miles before it just bursts.
After retiring from the game, Frank came back to Charlotte, spending 16 years working in local sports talk radio.
Sitting behind a desk, being stagnant is probably one of the worst things for an ex-athlete that was used to being active.
But now, approaching age 50, arthritis is invading his lower back.
You can feel that arthritis starting to creep in. You can feel your body starting to lock up. But then mentally, you start, becoming, a little depressed and a little discouraged.
With traditional medicine unable to help him, Frank went to NeoGenix in Ballantyne, a clinic specializing in stem cell and regenerative therapies.
For the typical low back case, we focus on the lower lumbar spine, and typically these joints called facet joints.
Dr. James Altizer has been practicing medicine for well over 30 years, spending 11 years as an internist, 17 as a vein surgeon, and the last 5 working with regenerative therapies.
This is the easiest of the 3, I'll say. It's the most rewarding of the 3 because just about every patient who comes in gets better.
Regenerative therapy consists of multiple levels, everything from over-the-counter products to platelet-rich plasma, which is where blood is spun in a centrifuge separating out the platelets, which are then injected back into an affected area to promote healing. Then there's stem cell therapy, which uses a patient's stem cells from either fat deposits and/or bone marrow.
Stem cell therapy is the only thing, to my knowledge, that can actually slow down the progression of arthritis.
Those regenerative cells need a jump start, and that's what you're doing by injecting your own stem cells into that joint.
All right.
Michael KECK is another NeoGenix patient. Unlike Frank, he's not a former professional athlete, but he did spend his fair amount of time in the gym.
Over 40 years of lifting weights, and I destroyed the cartilage in my shoulders to the point where I was in a lot of pain, constant pain.
Having already undergone 1 shoulder replacement surgery, Michael wanted to avoid getting the second one done. He went to another stem cell clinic, but a year later was still in pain. So he decided to make the drive from his home in Concord down to Ballantyne.
I brought my x-rays in. The doctor took a look at them, did an exam, a full exam. We came to the conclusion that, yes, I think I can help you.
Over 90% of people that I treat get better.
What sets NeoGenix apart from other clinics, Michael says, are a couple of main things. First, a full-time doctor on staff who analyzes every prospective patient.
And here's the key. They screen. They have an excellent success rate because they don't take patients they know they can't help.
And second, the fact that NeoGenix does live imaging, making sure injections are going exactly where they're supposed to go, which is something surprisingly not every clinic does.
There's an immediate confidence that they know what they're doing.
Despite all the advancements in recent years, regenerative therapies are still not recognized by mainstream medicine, and in many cases are not covered by insurance. But opinions are slowly starting to change.
If you go to an orthopedist 10 years from now with a bad knee, he's going to say to you, you have to get stem cells first before we can replace your joint because the insurance company says you have to do it that way. That will happen.
For now, though, that means people like Frank and Michael will continue paying out of pocket. But for them, the benefits far outweigh the costs.
The pain levels have gone down significantly.
I've had the stem cell injections 6 weeks ago. Shoulder feels great.
When you can get somebody out of pain and they can get their life back and they don't have to take pain pills every single day, and they can get back to doing the things that they want to do, it really does change people's lives.
I don't want to call it the fountain youth, but it almost feels like the fountain of youth. I found the fountain of youth with the stem cell therapy.
It may not be the fountain of youth, but as long as patients are in less pain and feeling better, I doubt you're going to hear anyone complaining.
New man.
For Carolina Impact, I'm Jason TERZIS reporting.
We hope you enjoyed the story. If you don't want to miss any more great stories about the Charlotte region, please subscribe to our YouTube channel.